radio frequency.
Thank you, Dr. Arham, for inviting me. Thank you, chairpersons. Actually, I selected sickle cell disease because it's a chronic disease. The patient is facing the pediatrician all through his life, and any complaint he goes to the treating doctor. So we have to cooperate to find solution for such patient. I'll try to cover it in the following 7 points. We have 2 types of pain. It depends on the nerve injury. If the injury to the tissues, not to the nerve, I mean to the skin, bone, muscles, tendon, ligaments, this is called nociceptive pain. العيان بيقول أنا موجوع. But if the injury to the nerve itself or the terminal branches, it is neuropathic pain, and the complaint usually it is some sort of abnormal electricity, كهرباء, حرقان, تنميل, numbness, and so on. So any type of pain, it's a mixture of both nociceptive and neuropathic, depending the ratio on the type of pain. When we talk about sickle cell disease, we have an abnormal hemoglobin. The abnormality not only in the shape, but rigid and sticky. So this leads to occlusion of blood vessels or slowing of the circulation of the blood vessels. And usually it presents in children suffering from pains, mainly in the upper and lower limbs, with other manifestations that all of you know better than me. And if you go to the pharmacotherapy, as said by Dr. Magda, so these children will go on to non-steroids and opiates for a long period of time. So we are expecting to have gastric problems ending into perforation. We are expecting renal problems ending into renal failure. We are expecting what's called opioid crisis. And by opioid crisis, either deaths, abuse, overuse of narcotics, because they have started, and addiction, they started for very early in life. The concept of electrotherapy, all of us are accepting this concept. We accept it as a psychiatrist for electroconvulsive therapy with marvelous results in catatonic patient. In cardiology, pacemakers has been used initially to control heart rate, but now the CRT machines, they improve the contractility of the heart. We as a pain physician, we accept the spinal cord stimulation, which another form of pain therapy, which has been used to treat patients who is more than one surgery in his back, and the back pain or sciatica is not improved. And now we move to what's called wireless spinal cord stimulator, because the batteries could be very small. Physiotherapists are using a lot of electrotherapy like TENS, infrared. So the concept of electrotherapy has been used in different specialties. Here, which type of electrotherapy that I do suggest for the management of chronic pediatric pain, not only for patients with sickle disease, but in another chronic pain, could be useful. It should be a non-invasive, second generation, medium range, with dental, vaginal, and external urethral probes. I mean by non-invasive, on the right side, there is an active plates, which whether plates or probes, we put it on the skin. On the left side, we put a passive plate, so we don't give the patient any single injection, which is very important in our pediatric population. What I mean by second generation, I mean there is an electric current coming from the active plate, hitting the passive plate, returning to the active plate, and this will lead to continuous bombardment of tissues, generating both electromagnetic field and internal heat. Both have a therapeutic effect on the patient. The range of radio frequency in green between 3 kilohertz to 300 megahertz, and usually we use a range between 300 kilohertz to 3 megahertz, and the machines that are available in Egypt is around 1 kilohertz, plus or minus. I meant by that that machines that have another probes, this is not for pediatric population, but I mean these very high-tech companies that can generate and produce these high frequency from specific probes. So this is a high very technology. So when we decide, when we say electrotherapy, we have to decide which generation. It's a new generation or an old generation, and any car has its unique name. So instead of saying non-invasive second generation medium range, we say TCAR therapy. So in the literature now, the word TCAR therapy is commonly written, and the word of TCAR coming from TE for transfer of energy. And as we see here on the screen of the machine, we see the amount of kilojoules. So the continuous bombardment of tissues creates energy, and this energy is directed immediately to tissues. And capacitive and resistive, these are the active probes of the machine. So TCAR therapy means transfer of energy between capacitive and resistive probes. If we are going to look to the exact mechanism of action, we have an active electrode, emits about 1 million cycles per second, hitting the passive electrode, returning to the active, leading to continuous bombardment of tissues, forming both electromagnetic as well as an internal heating of the tissues. This heat can be adjusted by the doctor. This will lead to increase the efficacy. As here, the above temperature by red is the adjusted temperature. We adjust the machine on 37, but it reached only around 30 degrees. So we still need further treatment to achieve what we adjusted. It can be controlled by the machine, by the patient, and by the doctor. We give the patient a button. If he feels abnormal heat, he can stop the machine immediately. So this will increase the safety of using of machine. The major advantage of the non-invasive that it works on all tissues. It can work on bone relieving subperiosteal edema, on the vessels, vasodilating vessels, on the nerves, neuromodulating nerves, relieving the muscle spasm and increase the power of the muscle, as well as it improves the tensile function of tendon and ligament and improve the function of fat, weather function, as well as texture. All these will relieve pain. If we go to the definition, so if we work on bone, muscle, tendon, ligament, and fat, we will improve the nociceptive component of pain. If we work on the nerve, we are going to relieve the neuropathic component of pain. If we're vasodilating the nerves, which the vessels, it will lead to improving the ischemic pain, which is very important here in patients with sickle disease. So by the end, we can say it increases vascularization, tissue trophism, as well as oxygenation and nutrition of tissues, increase regeneration capacity. And this is a very important point because it will open a new millennium to our critically ill patient and improving the function. On the cellular level, it opens the voltage-gated calcium channel, leading to production of oxygen-reactive substances, free radicals, as well as a potent vasodilator, nitric oxide. This will lead to stabilization of the cell and protecting the function of the cell. On the other, it leads to regeneration of new collagen by the fibroblast, new blood vessels, as well as regeneration of Schwann cells. Here, I will describe one of the real cases. In sickle cell, we have a pilot study on very few number of patients with marvelous results. But this a real case in a 17-year-old boy coming with severe ischemia. They sent it to us just to control pain before amputation. He's screaming from pain, cannot walk. His mother carrying him to go to the toilet. He had the 3 types of pain: neuropathic, nociceptive, as well as ischemic pain. When we examine the child, he has a gangrenous patch in the left foot and a gangrenous second finger in the right foot. His arteriogram show great amputation of the vascularity. It's above the knee on the left leg and below the knee in the right leg, the right side. So they are planning to do amputation for this patient, and it was diagnosed as vasculitis. A lot of pharmacotherapy with no improvement. He did lumbar sympathectomy with no improvement, and they sent this patient to us, try to control pain. The problem that I'm an anesthesiologist, so I know what is going to happen to this child. So I had a nightmare that day. I know they are going to do a tarsal amputation after a couple of months. They are going to do below knee amputation, and after a couple of months, they are going to do above knee amputation. This 17-year-old child, how much and how degree of depression, and his family and parents, how much they are going to be depressed. And if you go to the financial cost, whether the patient is going to pay, whether the community is going to pay, it's a major financial burden. So I remember one of the publications that I read, electricity is the new miracle in the treatment, in medical treatment. So could our electrical therapy using the second generation radiofrequency machines could be a solution? For me, it was unexpected and a marvelous result. There is a complete cure of the dorsum gangrenous spate on the foot, and the finger on the right side felt spontaneously from severe ischemia. And the second question, how many sessions we did for this patient? We did for this patient 40 sessions starting from January this year, and we are continuing till now. He's very intelligent. He coming, he says, I'm improving. So please give us sessions. So I think this is a financial saving, a humanity saving, and a family saving. So to conclude, we as pain physicians could rely on both invasive and non-invasive radiofrequency. The non-invasive radiofrequency has a lot of advantages. It's a non-invasive, which is very important in our pediatric population. It's a very low cost. It can be done in patients, even they are anticoagulated, without fearing from bleeding and hematoma. It can be repeated every day without any problem. So imagine I can do sympathectomy every day for such miserable patient. Again, it can reach a difficult areas like the superior and middle cervical sympathetic ganglia, which is very important in what Dr. Ilham said. If the pain becomes central, you can tackle this pain by working on the sympathetic chain, supplying the head and neck, including the brain. It can solve the anatomical problems and variation present in our adults as well as children. When we talk about the position of the ganglia, we say this ganglia could be here, could be there. So we have a great anatomical variation, especially in the thoracic area, that it's a nightmare when we are putting our needle in that area. And finally, we can do both sympathetic stimulation to the head and neck, as well as to the thoracic or even into the abdominal region. So I feel that a non-invasive radiofrequency second generation might open a new millennium for our children and even for our elders, making him a little bit happier. And thank you very much.
Thank you, Professor دكتور محمد. الكيس الحقيقة كانت very interesting، ويعني أنا عايز أعرف هو الفاسكولايتس كانت إيه سببها؟ هل ده من البين كيلر؟ يعني ده ستيفن جونسون ولا ده إيه؟ أصل القصة قوية.
لا حضرتك ده اسكيميك بيشنت، الارتيريوجرام بتاعه فيه اسكيميا، مفيش بلاد فلو نازل لتحت. هم شخصوها فاسكولايتس. يعني ايه فاسكولايتس؟ يعني هم مش عارفين السبب. بالاخر يعني شخصوها فاسكولايتس، ابتدوا فارماكوثيرابي، كل حاجه حضرتك تتخيليها، نون ستيرويدال، اوبيتس، كيتامين انترافينس، زيلوكين انترافينس، مغنيسيوم انترافينس. with failure, next step they do invasive lumbar sympathectomy. الانفيزيف lumbar sympathectomy في عين زي ده لازم اوقف الانتي كواجولانتس عشان اخش، عشان ما اعملوش epidural hematoma. No results, despite in this invasive lumbar sympathectomy is done by one of the expert pain physicians in Egypt. So he's sending us just to try to control pain before amputation عشان ما يجيلوش phantom pain وعشان ما يجيلوش complex اكسجنال بين سندروم، فهو جاست بعته فور بين كنترول. الدكتور احمد طه اللي هو رئيس اقسام الجراحه عندنا في القصر العيني هو اللي بعت لي العيان، ولما ابتدينا الريزلتس تتحسن احنا دلوقتي عاوزين نعمل واتس كولد بريفنتيف ميديسن، هوبينج ان احنا نقدر نمنع، لان ده الكلاسيك سيناريو زي ما انا وصفته لحضرتك كده. اتس هايلي ديستراكتيف سيناريو. انا كدكتور تخدير بشوف الاهل 3-4 مرات على مدار 8 شهور، انا بكتئب، فما بالك جراح اللي معاه كل يوم بيكتئب اكتر واكتر. لما نخش في بروبلم زي السيكل سيل انيميا، ده الولد والدكتور اعتقد انهم تحاولوا زي الاب والابن، هو معاه طول النهار بيقول له مشاكله، وفي الاخر انا ما عنديش بروبلم. فاي ثينك ان احنا moving to a non-pharmacotherapy might help, might improve, especially for resistant cases and difficult cases.
لو يعني هو الرول بتاع الالكتروثيرابي as pain management، بس في الفاسكولايتس هنا ايه يعني الاسكيميا، الريفرسال اوف اسكيميك تشينجز اللي حصلت، الرول بتاعها كان ولا ده من الميديكيشنز اللي اخذها ولا ايه؟
لا it's a role of the radio frequency. وزي ما انا قلت لحضرتك ان هو بيطلع نيتريك اوكسيد which is a potent vasodilator. الحاجه الاهم ان هو احنا اتعلمنا واحنا طلبه ان once a nerve cell has been destroyed، كان دايما يقولوا لنا اللي راح يا قلبي، يعني خلاص عين جاله neurological problem there is no solution. انما هنا وانا اشرت one of the publication بيعمل formation of new blood vessels and new Schwann cells. This means in the patients with neurological deficit might improve clinically. أنا يعني الحقيقة أتكلم على I have few cases of multiple sclerosis who improved neurologically using such a machine.
Thank you very much.
Thank you.